Hello everyone. My name is Simiran Choudhary and I welcome you all on behalf of Voice of Healthcare on the occasion of World Blood Donors Day 2025. We have come together to recognize an act that often goes unnoticed but holds the power to save lives. Voluntary blood donation. Every year, lakhs of patients across India depend on the kindness of strangers, donors who give not just blood but hope, time, and second chance at life. And this session titled Blood, Hope, and Humanity: The Power of Voluntary Donation aims to shed light on the life saving impact of voluntary blood donation, addresses the myths and misconceptions that prevent many from coming forward, and discuss how we as a society can build a stronger culture of regular, safe, and altruistic donation. To guide us through this important conversation, we are joined by Dr. Apurba Ghosh, Secretary General of the Federation of Blood Donor Organization of India, whose work has been instrumental in strengthening India's national blood donation movement. Welcome to our show. Such pleasure having you.
Thank you very much, Simiran Choudhary. I express my sincere thanks to the Voice of Healthcare for organizing this live virtual meeting, Blood, Hope and Humanity. The power of voluntary blood donation. Uh, the power of voluntary blood donation. It's really today, the 14th June 2025. It has been launched in 2004 on 14 June. 14 June is the birthday of Dr. Karl Landsteiner, the discoverer of ABO blood group discovered.
Yes.
Still, we know that there is no substitute of human blood, donated blood. Still now, there is no, now blood is one of the life-saving medicine of the world. As per the World Health Organization, life-saving blood is the first life-saving blood of medicine of the world. When one voluntary blood donor is donating his or her blood, it has been prepared with red blood concentrate, which is called RBC. Their lifespan is 42 days or 35 days, and platelet lifespan is 2 to 3 days, which is clotting our blood bleeding disorder of any patient, especially the dengue patient needs it, the liver problem, mother needs it. And medical science, there is no other alternative of life-saving medicine like these RBC, platelet or plasma or cryo or factor VIII, whatever may be. So this is 14 June from 2004. It was decided by the World Health Organization, International Society of Blood Transfusion and
So,
uh, I'm telling the story, which was, I'm telling a true journey of this World Blood Donor Day. World Blood Donor Day, it has been launched by WHO, World Health Organization, in 2004. The first World Blood Donor Day was launched. And in Kolkata, Science City, Kolkata, Federation of Blood Donor Organizations of India, involving the 26 states, the then National AIDS Control Organization under the Ministry of Health and Family Welfare Government of India. NACO was the only authority who was controlling the blood safety program in India and blood transfusion. And that day, on 11th of September in 2001, I was in South Africa, Johannesburg city. There was a 4 days World Congress organized by the World Health Organization, International Society of Blood Transfusion, and Federation of Red Cross and Red Crescent Society, Geneva. 4 days World Congress for this voluntary non-remunerated blood donation throughout the world. You know, 11th of September 2001, that was a red letter day. Now, since 2001, Pentagon and World Trade Center was demolished by Osama bin Laden's followers. That day, the meeting was going on in Johannesburg city for selecting a day for observing as the World Blood Donor Day in the world. Whole day the discussion was going on, but 11 countries member and I was representing my country, India. Myself and Dr. Jarin Borucha is no more now with us. She passed away. We represented our country at that Congress. Every country was trying to push their name as the World Blood Donor Day to the WHO Authority, International Federation Red Cross Authority, and ISBT, International Society of Blood Transfusion, but we cannot come to the conclusion. At the time of launch, still I remember Dr. Neelam Dhingra, she was the chief of the blood safety program, WHO Geneva. Still, she is working in WHO Geneva. She is one of my friends. She is still in WHO, but not in the blood safety program. But in the patient safety, now she is looking over the patient safety program in the globe. We cannot come to the conclusion. Everybody was demanding their important day of their respective country, like USA, United States of America, the birthday of Dr. Abraham Lincoln, from the Pakistan Red Crescent Society, the birthday of Muhammad Jinnah, and also so on, so on, so on, so on. So lastly, after the launch, I proposed that day. I do not know which date was the birthday of Dr. Karl Landsteiner, because he is the father of the transfusion medicine of the world still today. But in the medical science, the development which has been available now, every human body's lifespan is increased up to 70 to 75. Now our average lifespan, due to the miraculous medical advancement in the country, even in our country like India. The role of blood transfusion medicine, the role of voluntary blood donation is the behind this success story, who supported the medical advancement in the present context of the global scenario, that the medical system, medical faculty is totally based on the blood safety program. And that time when the NACO was founded in India in 97, 99, that time HIV positive 12% was coming through the contaminated blood transfusion in India. Because of that time, the HIV virus became the pandemic in the country of ours, India. And after that, NACP 1, NACP means National AIDS Control Project. National AIDS Control Project, the first project was 5 years. I was one of the member of the NACP 1, NACP 2, NACP 3, NACP 4. That is the 20 years 20-year journey of the blood safety program in India. And the 5 years, the first 5 years, it was the HIV free blood, safe blood should be available in our country. So that time, the when havoc campaign was done through the National AIDS Control Organization on World AIDS Day and the blood safety program, because blood safety was one of the major component from where the transfusion contaminated blood and this testing of blood, that time it was very much based on one method. Today our blood bank centers has transferred. Now there is no blood bank. There is now, it is called blood center, not bank. Now it is blood bank, not bank. Now it is blood center. It is research
Very
center.
right, very
Really,
rightly said, sir.
it is
But
blood
as
center.
you just explained us how the story and how these things started, we understand the importance of blood donation and everything. But still, there needs many awareness campaigns because India faces shortage of voluntary blood donation. So, what could be some key challenges that are preventing more people from donating blood regularly?
Uh, you have a very right question you have made, Simiran Choudhary ji. It's a very, very important question you have raised. I'm always telling, I have represented my country in the global field of 26 countries of the world, and I am telling this story everywhere. No child has born in this beautiful world as a voluntary blood donor. Child to be educated and child to be motivated. हमारे देश में एक कहानी है कि मुझे कोई जानकारी नहीं है. आई डू नॉट नो आई कैन हेल्प to save life of 3 people in every 3 months or 4 months. Now in our country, every male voluntary blood donor can donate blood in every 3 months, and female donor can donate blood every 4 months. So it was a question in 22 states in our country. Many of us, 92% donor replied like that. I do not know that I can save somebody's life, which is more important. So this is in our so-called educational system. There is no lesson. There is no awareness program. People do not know what is blood, how it comes in our body, and how it protects, how you can donate blood, and who can donate blood, who cannot. This is so many things is very important. And according to World Health Organization, 2020 mission, WHO, there was a mission that by 2020, every country should achieve 100% voluntary blood donation. And what is voluntary blood donation? Voluntary blood donation is like this: who donate his or her blood, plasma, whatever may be, without any incentive, without any gift, without any intention, only with the values that I am saving somebody's life, only with the values that I am saving somebody's life. That is the only values of a voluntary blood donor. Previously, before the law of the land, our Honorable Supreme Court 96 historic judgment came from the Supreme Court. Buying and selling of human donated blood was banned in India. Supreme Court has not banned, it has not came from the heaven. Mrs. Kanta Swarup Kishan, the pioneer lady in voluntary blood program working in the donor motivation campaign from the city of Chandigarh. She was the wife of a chief secretary of the then Punjab, Haryana, and this Union Territory of Chandigarh. started the Indian Society of Blood Transfusion and Immunohematology, which is called ISBTI. I was also before the Secretary General Chief in Federation of Blood Donor Organization of India. I was the Secretary General of Indian Society of Blood Transfusion and Immunohematology. So that time she has started the journey for motivation is a science based on art. Motivating somebody for donating blood to save somebody's life, it is very, very important.
It is.
Child to
It
be
is.
educated, child to
It
be
is very
educated,
important, sir. It
is
is.
a long journey. Every 18 years in our country, 18 years to now 65 years, you can donate blood. But before 18 years, if you do not get any information about the blood science and the need of blood in our country, at present in India, but the life-saving blood need of blood per year is 14 million units. 14 million units of blood and blood component is required in our country for saving the life of the ailing patient in our motherland. Like thalassemia, every month they need two transfusion at least. This childbirth at the time of mother needs blood transfusion, bleeding disorder, hemoglobinopathies, cancer. Now 10 is to one family is suffering with cancer. And cancer, the medical treatment of this cancer to fight against cancer, it is very important to know the chemotherapy. The chemotherapy is very much important. This your blood cell is dying after this chemotherapy. So the
Rightly
patient
said,
needs.
sir. Now, I would like to know from you that despite many awareness sessions and everything, there are still many misconceptions around blood donation. So, from fear of weakness to safety concern, could you help us burst some of these common myths for our viewers that there's no myths and misconception for donating blood?
In fact, there is no chances of any contamination during the blood donation. There is no chances, no 0% chances भी नहीं है because the disposable syringe is being used and the blood bag which is manufactured by so many international health authorities is very much safe and it is being tested by so many laboratories by the Drug Control General of India, by the National Health Authority of India, and there are the needle of these blood bag kits. It is very, very, very important part, very safe, 100% safe. No question of reuse of this needle. There is no chances for any infection by way of getting infection at the time of bleeding. So it is part of this. This needle is part of the blood bag, and blood bag is tested by so many health agencies like the DCGI, Drug Control General of India, like the licensing authority, state authority, central authority. So blood safety program, voluntary blood donation program is very very safe. You cannot get any infection at the time of donating blood. At the time of receiving blood, there is a chances because no blood is 100% safe because this blood, the window period infection is there. If the blood donor carrying the virus of window period infection of HIV-1, HIV-2, HIV-3, hepatitis B, hepatitis C, whatever may be, which is not being 100% tested, positivity is not coming through this ELIJA method, or fourth generation kids, even in the NAT tested blood, 3 4 days chances is there. So blood transfusion, medical transfusion, it is the experts are saying blood transfusion is like a nuclear war. You know, the Second World War has been was over in 1939, 1940. After that, there was no Third World War still now because this nuclear power is being not used in the health arena also. The blood transfusion is also like a nuclear war. It should be utilized by the medical practitioner at the time when there is no other alternative. Then only the transfusion should be done. That's why in our country, single unit of transfusion is very much like a consolation prize. The medical experts are not suggesting single unit of transfusion because of that. So this is very important. This very wisely transfusion should be done.
Rightly said, sir. But I just, if we want to understand that how is Federation of Blood Donor Organization of India is contributing to the national blood donation movement, can you share some of the key initiatives of the success story behind this?
I know that today from the early morning I was busy with the some donor organization felicitation, the Centurion Blood Donor felicitation. So you felicitate your the first World Blood Donor Day 2004 to salute the unsung heroes. We know our heroes of Shah Rukh Khan, Salman Khan, Akshay Kumar. There are a lot of because before that Amitabh Bachchan, Dilip Kumar. So a lot of all these heroes, but people do not know the unsung heroes and heroines who are donating blood regularly for the countrymen. Once our great freedom fighter Netaji Subhash Chandra Bose asked to the countrymen, "Give me blood, I shall promise you freedom. तुम मुझे खून दो, मैं तुझे आजादी दूंगा." So this is very important that this message should be every moment, every time somebody needs blood. 14 million units, that is 1 crore 40 lakhs units of red blood concentrate, platelet, plasma, cryo, whatever may be the component is being required by the dying patient. Every day, every moment, blood is needed throughout the country. And there are about 4,600 blood centers now in India, out of which 1162 is governed by the state government, central government, and remaining some others are trust like this Rotary Blood Bank, Lions Blood Bank, Ramakrishna Mission Blood Bank. There are so many private blood centers. So we need people should come forward. And this is also very true story that if a person donate blood regularly, every 3 months or every 4 months, she may not face major cardiac attack. She may not face disease like cancer, disease like cerebral attack, because the old blood is going out from your body and the new blood is coming from your bone marrow, is producing the new blood, and you are getting the new blood with the fresh oxygen, fresh factor 8, fresh platelet. So this donating blood is also a very good exercise of your body.
Very, very rightly said, sir. It is definitely a good exercise, and people should donate their blood regularly. And like we just discussed about, there is no safety concern. Everything is being taken care very well from
Very
the
well.
person who is donating the blood and from the end of receiving it, because all the testings are being done. Then only it gets transferred to the person who needs blood. So I think our medical, like you also mentioned, our medical sector had made a lot of advancements, and because of that we have reached to this level right now. So with this we have come to end of our session, so I have my last question from you. Finally, what message would you like to give to someone who is eligible to donate blood but hesitate or unaware of its impact? Can you please guide and motivate our viewers for this?
आप जिंदगी में कुछ भी नहीं कर सकते हो तो कोई दुख नहीं है। एक बार खून तो देकर हम लोग बोलते हैं, खून देने का टाइम में थोड़ा सा डर लगते है, खून देने का पहले थोड़ा सा डर लगते है। खून, I have also donated my blood 113 times. I am a centurion blood donor. So I am 70 plus now. So now I cannot donate blood. But I have donated blood 113 times. So कुछ तो अच्छा काम कीजिए। और अच्छा काम के लिए दुनिया में सबसे ज्यादा ज्यादा इजीएस्ट जो काम है वो रक्तदान करके देखिए, अच्छा लगता है। तो रक्तदान देने का पहले थोड़ा सा डर लगता है, देने के टाइम में सुई का डर से थोड़ा सा पेन लगते हैं, और देने का बाद बहुत अच्छा लगता है। ये 3 मरीज को आज मैं जिंदगी से बचा लिया है। इससे इससे अच्छा इससे अच्छा मैसेज तो आपको जिंदगी में कुछ नहीं मिल सकता है। यू कैन गेट बैक दिस 3 गुड। देने का पहले डर लगता है, देने का टाइम में छोटा सा डर लगता है, देने का टाइम में बहुत अच्छा लगता है। 3 मरता हुआ इंसान को जान मैंने आज बचा लिया है। इससे अच्छा मैसेज दुनिया में कुछ नहीं हो सकता।
एकदम सही कहा सर, इससे अच्छा मैसेज और कुछ नहीं हो सकता। अच्छा काम कीजिए, रक्तदान कीजिए जैसा कि आपने कहा। एंड थैंक यू सो मच फॉर मोटिवेटिंग एंड क्रिएटिंग दिस अवेयरनेस अमंगस्ट द व्यूअर्स and the public, because it is a very important cause to work on, and I believe there should be no hesitancy. If you are qualified, you are eligible, medically eligible to donate blood, then you must donate blood. It saves someone's lives at any point of time. And let's not be hesitant from now onwards and donate our blood boldly to the person who need it somewhere in a future. So thank you so much, Dr. Ghosh, for talking to us, having this conversation, and helping us to aware our public out there for this important cause. And thank you so much for all the contribution you
थैंक यू।
have made in this sector. Thank you so much, sir.
थैंक यू वेरी मच।
Thank you, sir.